Hello guys, today we are going to discuss about a lab test called catecholamines. This can be done in either blood or urine. Let us focus on urine sample, which is done commonly. Use of the test. To help diagnose or rule out a pheochromocytoma or other neurocrine tumor or cancers. This may be required if you have symptoms of a persistent or episodic high blood pressure, such as severe headache, rapid heart rate, and sweating. Catecholamines are group of a similar hormones produced in the medulla, central portion of the adrenal gland. The adrenal gland are small, triangular organs which sit on top of each kidney. The main catecholamines are dopamine, adrenaline, noradrenaline. These hormones are released into the bloodstream in response to physical or emotional stress. They help transmit nerve impulses in the brain, increase the release of a glucose and fatty acid into the blood, widen the small air passages in the lungs, and widen the pupils of eye. Noradrenaline also reduces the size of the blood vessels, and adrenaline increases heart rate and metabolism. After completing their actions, the hormones are metabolized to form inactive compounds, metabolites. Dopamine becomes 3-methoxytryptamine and homovalenic acid. Noradrenaline changes to normethoprine and hydroxymethylmandelic acid, also called vinyl acid. And adrenaline becomes metanephrine and HMMA. Both the hormones and their metabolites are removed in the urine. Normally, catecholamines and their metabolites are present in the body in small, varying amount that only increase greatly during and shortly after a period of stress. Pheochromocytomas and other neuroendocrine tumors, however, can produce large amount of catecholamines, resulting in greatly increased levels of hormones and their metabolites in both blood and urine. This can cause persistent high blood pressure and bout or episodes of a very high blood pressure, resulting in severe headache, palpitations, sweating, sickness, anxiety, tingling in fingers and toes. About 80 to 85% of pheochromocytoma are found in the adrenal gland. A few are cancerous, however, most are benign and do not spread beyond their original location. Although most do continue to grow, left untreated, the symptoms may get worse as the tumor grows and over a period of time, the high blood pressure that the pheochromocytoma causes may damage body organs such as kidneys, heart, and increase the risk of a stroke or heart attack. Urine and plasma catecholamines and catecholamine metabolites testing can be used to help detect the presence of pheochromocytoma. Only 0.1 to 0.6% of the cases of a high blood pressure are due to pheochromocytoma, but this is one of the few cases of high blood pressure that can be cured. So it is important to diagnose and treat these rare tumors. In most cases, the tumors can be surgically removed and treated to reduce the amount of catecholamines being produced, thus reducing or removing symptoms and complications. Catecholamines testing measures the amount of adrenaline, noradrenaline, and dopamine in the plasma or urine. Increasingly, laboratories are measuring the catecholamine metabolites, no meta-adrenaline and nor-meta-adrenaline in urine or plasma as well. As recent evidence suggests, they are more reliable tests because they are continuously produced by the tumor. The plasma catecholamine test measures the amount of a hormone present in the moment of collection, while urine test measures the amount excreted over a 24-hour period. Sample: a 24-hour urine sample collected into a bottle containing a small amount of acid, or possibly a blood sample taken from a vein or in the arm. These tests are affected by certain drugs, foods, and stresses. Inform your doctor of any medicine you are taking and follow any instructions you are given for things to do or food to avoid before sample collection. Total urine catecholamines 14 to 110 microgram per 24 hours. That is about catecholamines.